Yeah, hey, Blind Guy doing stuff here today, and been a while since we've been on the YouTube channel. Been having some technical difficulties, had to reinstall my broadcasting software. I was trying to use something else that was giving me problems. I was having some pops, this, that, and other. Always some kind of problem going on here, Blind Guy doing stuff studios. But we are back, and we're going to do a series of videos, sort of catching up. And this one I want to do on the latest cannabis article I wrote. You can find this on cannabisfn.com, and it is called the best marijuana strains for pain, or the best cannabis strains for pain. And we'll just kind of go over this real quick. So, there are studies out there to show cannabis to be a great treatment for chronic pain. And chronic pain is described as pain that lasts more than 12 weeks. So, if you got pain that results from like a surgery or a broken bone, or if you have arthritis or MS and sometimes cancer, long-term chemotherapy, that definitely can be long considered chronic pain. This is all types of chronic pain, and from my experience, most people have chronic pain. Um, Everybody's got some kind of hurt on them somewhere, so this is a very widespread issue. People with chronic pain, and just so happens that cannabis is a great treatment for that chronic pain. And because the cannabis interacts with the endocannabinoid system, it can even go a long way to helping uh, cure or heal the problem that is causing the pain. So, pain usually is caused by inflammation, and there's just so happens to be some things in marijuana that work for inflammation. That's CBD, THC, and terpenes. So, CBD stands for cannabidiol or cannabidiol, depending on how you want to say it, and tetrahydrocannabinol is THC. CBD is a lesser known molecule that was discovered in the 1960s. It works with the endocannabinoid system, that's anti inflammatory, and has some really strong healing properties, almost even more than the THC. It can help with pain. THC has also been shown to be anti-inflammatory, and the one of the big anti-inflammatories in cannabis are the terpenes. And terpenes are the cannabis molecules out there that the molecules in cannabis that give cannabis its smell. So if you smell cannabis, um, you put your nose to it and give it a sniff. That's the terpene you're smelling. So the ones that work with pain or for inflammation and pain are there's a bunch of different terpenes, but one of the three of them that really specifically work for inflammation. One is linalool. That's the floral smell. It comes from lavender, like the purple shades on cannabis comes from linalool. And then you have alpha pinene, like the piney smell, very common cannabis terpene. And the next one is caryopylene, and this is the woody, sort of spicy taste and smell that comes from cannabis, or beta caryopylene, depending on which one. I've seen some say caryopylene, and I've seen others say beta caryopylene. So we're just going to go with caryopylene. So what are some specific strains? So you got the things you need to look for: CBD and THC and terpenes. So that's what does the inflammation or works for the inflammation. But what are some specific strains? So the first one, and I included 5 of these in my article. You can check out the article there in the description. First one up is Cannatonics, and Cannatonics is a high CBD 2-to-1 marijuana strain that is very resinous and puts out a lot of resin, and is 2-to-1 means it has twice as much CBD as it does THC. So if it's 16% CBD, it'd be 8% THC, and it's a great a great medicine for pain, as it has the CBD, the THC, and high concentrations of linalool and alpha pinene and caryopylene. So this cannabis strain is very good for pain. Cannatonic. Next one we're going to go over is Granddaddy Purple. This is a purple strain. It is used for help with sleep. The reason why is a high THC strain, and it has a lot of linalool and alpha pinene. And an aside, a lot of purples do work for pain. So purple Urkel, and there's a whole bunch of other purple diesel. There's just purples. They always got some kind of purples going on. So there's a lot of purples, and they will work with pain. So the next one we talk about is I'm trying to think of the next one would be ACDC. So ACDC is a high CBD strain that has below 0.1% or 1.0% THC. So it almost has no THC in it. So you don't even get a THC high. It's just all CBD and terpenes. And it just so happens the largest terpene count in ACDC is alpha-pinene. So that is a great strain for pain. And next one up is Jack Herer. And I included this one because it's very potent. It's been around for a long time. And it also has a high THC level. So it can be good for pain at the higher the THC level. And it also has alpha-pinene and caryophyllene are its major terpenes. So Jack Herer is another good one to use for pain. And there's a whole lot more. So, a good thing to ask is in your dispensary or wherever you go, look for linalool, alpinene, and caryophyllene if they test for terpenes, and you want to look for the high CBD. And if you're out there getting it on, different places, just look for the piney smell. That's something you're going to be the one to look for, or the kind of the fruit, the smell, floral smell from like a Blue Dream or something. So next I want to talk about applications of how to use cannabis to treat pain. So the great thing about cannabis is it's very versatile product. So you can make just all sorts of things that will help with pain, and you can apply them directly on the inflamed area. So let's say you have you had surgery on your knee, and your knee has been hurting you from old sports injury. Well, you can get some lotion or cannabis salves. You can either make them yourselves or go to the store if you're so lucky to live in a place you can get them yourselves, and you can make a lotion and you just rub it right there on your knee. So the pain relief goes right to your knee. It absorbs right in your skin. And the topical way is twice as much absorption than inhaling. Now, inhaling cannabis is good for more acute pain, or if you're having like headaches, because cannabis, and when you inhale it, goes straight to the brain. It goes to the lungs, then to the brain, to the heart, and then pumps it right up to the brain. So cannabis inhaling is not very absorbent, so you have to use more, but it's good for more acute pain. And if you have pain in your head or your upper body area. So next up, what we can talk about is the last cannabis consumption method that will help with chronic pain is edibles. Now, eating cannabis is 5 times, or eating marijuana is 5 times more absorbent than inhaling. So that's the most efficient way to get it. And if you have pain like in your internal organs, let's say you have cancer in some, like your stomach or your intestines, or you had a surgery somewhere down there and you're hurting there, that is a way to apply the cannabis directly into that hurt area, and it will help heal the area. There is one other method, a suppository, that of course up the backside, and that is very absorbent, and that is also will help with internal pain and more absorption with cannabis. So lots of different things to know about cannabis and chronic pain, but the best thing to know is the terpenes, and also it's important to know that you can apply the cannabis directly to the inflamed area, and that will help the most with pain. So a couple different things there. So thanks for checking out my video today, Blind Guy Doing Stuff. Please hit like and subscribe. We'll be doing more of these. I'm going to start sort of transferring everything I'm doing to this YouTube channel. So I'm going to start trying to get on my Cannabis Corner show. I'm going to try to start getting on my Freebase Radio show. I'm going to try to start getting my cannabis writing on here. I'm going to start getting some other things I'm doing. So we are really trying to focus in on YouTube, sort of leaving Facebook and Twitter and everything behind for a little while and working right here on YouTube. So please hit like, subscribe, and thank you so much. Have a good day. Bye-bye.